If re-elected, ACT Labor plans to take more action on tobacco, alcohol and drug use in the capital. The recent policy announcement involves an increase to the number of smoke-free public areas and provides $800,000 in funding for Aboriginal and Torres Strait Islander smoking cessation programs. Labor has also allocated $1.4 million towards establishing an alcohol and drug outpatient service. Dr. Mary Walker from the Australian National Council on Drugs was unable to talk to us on camera, but had this comment about the proposed outpatient service.
I think it will do a lot of good. It's a type of service that there is more demand for than supply of everywhere, and there are currently limited offerings from the public health system in the ACT.
Katie Gallagher and her team will pursue restrictions on smoking and improve public awareness of existing no smoking policies in public areas around the capital. Some areas include public playgrounds, sporting fields when children are present, covered bus interchanges, university campuses, building entrances and large public gatherings and outdoor events. Tobacco Control Officer at the ACT Cancer Council, Bernadette Urack, says increasing the number of smoke-free areas in the community is a great start to reducing rates of smoking in Canberra.
I think it'll have really very positive ramifications for reducing the rate. Overall in the ACT the rate is fairly low, but of course we want to get that as low as possible, and this is just one additive to that.
However, after speaking with members of the community, some smokers strongly disagree.
I don't like how they've put the smoking areas so far out of campus that smokers don't even know that they're there. They could be more accommodating, maybe make it more central, and then people would use them more.
I can understand what they're trying to do, but why are they just targeting smokers? They just seem to be always about the smokers. You know, I know that's got health risk, but what about people who drink alcohol? Are they closing down bars and outdoor areas where you can drink alcohol and that as well?
If you want to contain the threat or the danger caused by smoking, then ban it altogether. Make it illegal. To say that you can do it here and you can't do it there, or you can do it in this condition and you can't, is a fundamental act of cowardice. You either agree with smoking or you don't. You either want it in your town or you don't. And if you don't want it, then make a law that says that no one can smoke anywhere and I'll stop smoking. I don't want to break the law, but I don't want laws to be unjust either. Why is it that you can do these things with smoking, but smoking causes less deaths in this country than obesity and type 2 diabetes and the things caused by fatty foods? If you're going to say I can't smoke anywhere, then put big ugly pictures on Big Macs so nobody wants to buy them. But you won't do that because firstly, you know smoking is an addiction and people will do it anyway regardless of what you say, and you want the taxes.
Some smokers may not have considered the other positive aspects of Labor's policy.
What I think is really significant about this particular policy is their investment in initiatives to target Indigenous smoking rates. So we know that they're much, much higher than that of the general population. Often rates are quoted at about 45%. As I said before, the rate in the ACT is 11%, so that's significantly higher, and that is really screaming out for more initiatives and interventions. So there wasn't a lot of detail in the policy as to what this $800,000 is actually going to be spent on, but any investment in tobacco control for a disadvantaged group is something that we welcome and that I'm sure many health advocates do as well.
This is Philip Morton reporting for Next Act.